Firstly, wash your hands. Next, introduce yourself to the patient and obtain consent. Ask the patient to expose the neck, chest, and both upper limbs until the iliac crest. Ask the patient to walk to assess the gait.
Miss, can you walk for me?
With the patient in standing position, inspect the posterior aspect for the attitude of the head, neck, and pelvis. Inspect for shoulder tilt and pelvic tilt. Noted for any skin changes like scars and hair tuft, and also inspect for any muscle wasting, and lastly scoliosis. Next, we move to the lateral aspect. Inspect for the loss of cervical lordosis, thoracic kyphosis, or lumbar lordosis. For the anterior aspect, inspect for facial asymmetry, any swelling over anterior aspect of neck, prominent sternocleidomastoid muscle or fibrotic muscle, chest wall asymmetry, the shoulder tilt and pelvic tilt, and any skin changes should be noted. Ask for the maximal point of pain before starting and palpate the exact site of tenderness.
Do you have any pain on your back? No. I will examine now. Please tell me if you have any pain. Okay.
Check for the temperature.
Identify the spine level first by finding the most prominent spinous process. Then palpate the paraspinal muscles for any tenderness. Palpate for any step deformity over the spine. Assess the range of movement of the cervical vertebrae for flexion and extension.
Backward. Can you tilt your head right and left?
Then the right and left lateral flexion.
Can you move your head right and left?
And also axial rotation.
Next, assess the range of movement of the thoracic vertebrae.
Can you cross your hands over shoulder and move to the right and left?
For lumbar vertebrae, assess the range of movement for flexion and extension.
Miss, can you bend forward and touch your toes and bend backward?
Then,
Right and left lateral flexion.
Try to bend at your right and left while touching your knees.
The first special test we are going to do is Skober's test for ankylosing spondylitis. First, identify the posterior superior iliac spine. Then marks 2 points which are 10 cm proximal to the point and 5 cm distal to the point. Ask the patient to bend forward, then measure the distance between the two furthest points. The next special test is Adams forward bending test. Make sure both of the knees are extended. If the contour of the posterior thorax assumes symmetrical fall, then the underlying scoliosis is considered to be functional. If the contour of the posterior thorax assumes asymmetrical fall, then the underlying scoliosis is considered to be structural. Another special tests are straight leg rest test, sciatic stretch test, and femoral stretch test for prolapsed intervertebral disc. For the straight leg rest test, with the knee extended, passively flex the hip to lift the lower limb to reproduce pain over the back radiating to the lower limb. Watch for distribution of pain to indicate involvement of nerve root. Following the straight leg rest test, perform the sciatic stretch test. Drop the limb to about 10 degrees to relieve the tension on the irritated nerve root. Then, dorsiflex the ankle to reproduce the stretching effect on the nerve root, thus will reproduce the sciatica pain. With the patient in prone position, the knee is passively flexed with the hip extended. The test is positive if there's any pain is felt over the anterior aspect of the thigh.
to complete examination, do upper and lower limb examination and also neurovascular examination. Don't forget to thank the patient.